Peripheral neuropathy, absolutely, for most of you, can be helped. I know many of you have been told by your healthcare providers, probably multiple healthcare providers, that, you know what, you have neuropathy, there's not a whole lot that we can do. And I want to tell you, as I said just a second ago, I want to tell you for most of you, that is just not accurate. Even before listening to this video, if you wanted to click on the testimonial part of this website, please do, because there are patients after patients after patients that I treat, examine, and consult with that come in very, very skeptical because they've been told by some of their top doctors that there's nothing that can be done. So we treat I treat medical doctors, I treat school teachers, I treat CEOs of companies that came in, pretty smart people that came in very, very skeptical, that are now astonished. Okay, I'll say that they're extremely, extremely happy with the results that they've gotten, but the results are a result of a very, very strategic, a very schematic plan that we have based on the latest science and data and information on peripheral neuropathy. Okay, so there's reasons why they get better. So what I'm going to do over the next few minutes is really break down some of the causes of neuropathy. Okay, we'll talk about the causes. We'll talk about how to get you better. We'll also compare and contrast some of the other treatments that are out there. Nowadays, and it's cropped up here over the last probably 6 to 8 months, a lot of advertisements that I see for neuropathy. And I've checked on the programs because it was surprising to me, because the schooling that I went through took a long, long time to be able to do this. So what I want to do is help you save time, energy, and money, but I want to back that up with science. Okay? So this website is absolutely designed to help you, and I'd encourage you to take the few minutes to listen to this video and click around so you get the most up-to-date information on how you can get better. So I'm telling you, without a shadow of a doubt, with most of you, there's a lot of hope. Okay? My name's Dr. Daniel Roney, and I want to welcome you to ocperipheralneuropathyhelp.com, and I want to thank you for visiting our website. Here we go. So let's talk about, first and foremost, the causes. All right. There are 3 main causes, okay, categories I should say, to why peripheral neuropathy happens. Number one is metabolic conditions. Okay, what that means is your blood chemistry, how your cells are reacting and working, is not doing a good. They're not doing a good job. Okay, so that's metabolic, and I'll break those down. Mechanically, meaning you have problems with the spine where nerves exit, whether it's degeneration, spinal stenosis, disc degeneration, osteoarthritis, facet arthrosis. You may have problems in the ankle joint itself where the nerves and the arteries go through. Okay, so that's mechanically. So you have metabolically, you have mechanically, and then you also may have some neurological issues that we'll talk about as well. Okay, and they manifest as balance and coordination problems, etc. All right, so we'll back up just a hair and we'll talk about metabolic conditions. Remember, one thing that I want you to know first and foremost is that peripheral neuropathy, your neuropathy, has a cause. So even though your doctor may have said, you know what, I'm not sure what's going on and I don't know why it's happening, it doesn't mean that there's not something happening. It means that that particular doctor just didn't know what's going on. Well, based on the latest that we know in the scientific community about neuropathy, the causes could be this many. I mean, there could be a lot of causes, and most of my patients have multiple causes of their neuropathy. So metabolically, what could be happening? Well, you could have problems with blood glucose regulation. So that can manifest with diabetes, that could be hypoglycemia, insulin resistance. We could have problems with anemia, whether it's subclinical anemia or clinical anemia. And anemia, just so you know, is lack of oxygen content in the blood. Okay, and that's a huge factor. My patients could have thyroid issues. They could have adrenal issues. They could have metabolic problems because of their cholesterol medications, their statin medication use. They could have blood pressure issues and creating problems and neuropathy symptoms because of their blood pressure medications. They could have stomach acid issues that will create some neuropathy type of symptoms. So metabolically, you could have a lot of these things going on, and most of my patients do. What that translates to, okay, with, again, what we understand in the scientific community about neuropathy these days, is it really boils down to a couple things. Those metabolic conditions will cause something called anoxia, which is lack of oxygen supply, and that lack of oxygen supply affects the nerves, okay? So if you don't have enough oxygen, that's very, very bad. A lot of those metabolic conditions that I talked about will affect your oxygen content and the way you're supplying your nerves with oxygen. Number two, you can create something called, with those metabolic conditions, something called oxidative phosphorylation, which is a big fancy term that just means you're not producing enough energy for the cell. So if you have lack of oxygen, lack of blood flow, and lack of energy to the cell, guess what's going to happen? You're going to get neuropathy. Those nerves or neurons are going to become damaged. So your sensory nerves, the nerves that feel hot and cold and touch and vibration and pressure, okay, that give you signs and symptoms like tingling and numbness and burning and stabbing, and you feel like you're walking on tacks at times, you're having difficulty walking, difficulty sleeping, etc. They're cold, they're hot, what have you. Those symptoms are created mainly because of lack of oxygen, blood, and energy supplied to the cell. But they are caused by all those metabolic conditions that we talked about. Okay? So that understanding is critical for you to get better, because if we don't understand those and then we don't know how to examine those in healthcare, then we have no shot at getting your neuropathy better, because they are the main causes of your neuropathy. Okay? So examine, do extensive lab panels to find out metabolically what's going on in your body, because those metabolic irregularities, if you will, are one of the main causes of your neuropathy. Okay? So most of you have been giving gabapentin or Neurontin or something like that to treat your neuropathy. Well, let's put it this way. If you stop taking that Neurontin or gabapentin, then the symptoms are going to be there in full force. Okay? Our objective, okay, and I understand the need for those medications to allow you to function, but the reality is, if you stop taking it, the problem continues on, because all these metabolic conditions have not been addressed. So the cause of the neuropathy has not been addressed, and that's what absolutely needs to be done. Okay? We'll continue with that thought process in just a minute. In addition to those metabolic problems, we see the mechanical issues. We see mechanical issues in the form of your stenosis, your spinal degeneration, your disc degeneration, etc. And what that does, it compresses nerves and arteries that run down the leg. Now, for most of you, is that a primary reason for your neuropathy? Probably not, but it is a contributing factor. And the way I treat neuropathy is we don't leave any rock unturned. So if you have mechanical issues, if you have these metabolic issues, and neurological issues, which I'll talk about in just a second, and none of them are being addressed, you've got no shot at getting better. It's that simple, okay? So we talked about metabolic, we talked about mechanical. Neurologically, here's what we start to see, okay? We start to see an imbalance that's created in the brain. Now, for many of you, you have a hard time feeling where your feet are on the ground, because you've lost the sensation, you lost the touch, the nerve fiber that controls touch, you've lost the sensation, etc. So what's happening is your sensation of touch or pressure is not being related to the brain. And one of the areas that becomes greatly affected is your cerebellum of the brain, because that's not getting the stimuli it needs. There's lack of oxygen and fuel supply as well. But what that translates and manifests in is balance and coordination issues. If you've ever seen the show Cops, when they do their test, you know, here and trying to test somebody that's inebriated, and have them walk in a straight line, etc. Those are tests on the cerebellum. And for most of you, you have balance and coordination issues that have come over time. Now, partially related to the neuropathy, but some other factors as well. Now, those things, the brain is just like a muscle. Unless it has the right fuel and activation and stimulation, it starts to weaken. And those balance and coordination issues are simply a secondary effect of lack of stimulation and activation to that brain. They can be helped tremendously, okay? So we see that a lot neurologically going on. There's issues that happen in the brain as a result of the neuropathy. Let's back up. Once again, if you have mechanical issues, if you have neurological issues, and you have metabolic issues, okay, they all have to be addressed in order to get your neuropathy better, okay? Here's a biggie. There's a lot of advertisement out there for things like laser and TENS units and things like that. Now, you can surmise, based on what I've told you already, hopefully you can surmise, that those lasers or those TENS units or what have you, although can be short-term, can be effective short-term because they'll help you manage some of the discomfort, how on earth in a year from now, if you have neurological, metabolic, and mechanical issues that aren't addressed, how can a laser or a TENS unit help you in a year? Well, the answer is they're not, okay? Because it's all short-term. You could feel better in a day, in a week, or whatever using that treatment, but once that treatment stops, you still have all these other problems going on. The medications are the same way. Once you stop the medication, all these metabolic issues, all these neurological issues, all these mechanical issues are still going on. So there's the time, energy, and money saver. Okay, save your time, save your energy, save your money, unless, you know, the only caveat is, unless you're fine with spending money on short-term gains. That's okay. I'm all right with this. What we do is try to give you tools, try to correct problems so that a year from now, 5 years from now, you still don't have causes driving the neuropathy to progressively get worse. Because again, neuropathy is very progressive because the causes of the neuropathy are rarely, if ever, addressed. Meaning the causes aren't addressed, it's going to continue to damage your nerves, and you're going to continue to have worse and worse and worse neuropathy-like symptoms, unless these symptoms are addressed mechanically, neurologically, and metabolically. That is the key. The other factor that we do therapy-wise is we stimulate, okay, via proper treatment program. We want to increase oxygen supply. We want to increase stimulation to those sensory nerve fibers that have been damaged. And by doing a combination of correcting the causes metabolically, neurologically, and mechanically, and stimulating properly the damaged nerves, okay, and trying to reverse some of that damage, we have a treatment program that works phenomenally well. Okay? And again, the testimonials, don't listen to I just gave you some of the science behind it, but the testimonials will absolutely help you tremendously, okay, with the understanding this program and validating what we're talking about. So hopefully it makes a lot of sense. You know, you just have to do the right thing in order to get the problem resolved. That's what we all know in the scientific community with neuropathy, everything I went over here today. And as a result, with this video and this website, I give patients the option to come in and see me. And when they come see me, there's free visits involved. And the reason I do that is so you can have a chance to come see me, let me evaluate you, let me review all of your diagnostic studies, all of your lab findings, and find out, A, do we have enough information, do we need more, and B, can I help you, okay? So what you'll find here, and what the testimonials will probably say, I'm extremely honest, I'm extremely caring, and I'm extremely fair. And to me, when you come for those initial visits, there's no cost involved. It's a fair way to assess whether or not I can help you. And that's pretty simple. Okay? So you have that option. You can also order some more information in the form of a DVD that really goes into a lot of the science that we talked about in this video. So you have that option as well. But either way, if you have any questions or concerns, you know, feel free to call, feel free to contact us. But what I want you to know more than anything, and I tried to explain, is that there's hope. And the science and the data that we now know backs that up. It's just not well known in healthcare today. Okay? So I wish you the best, and hopefully we'll see you soon.